Our commitment to patient safety starts at the very top, at our governing board level. This is translated into action through policies, procedures, technologies, and commitment to make sure that every patient that comes through the doors of Shaukat Khanum receives safe and effective care. A number of different technologies and strategies are adopted to ensure that this indeed happens on the floor and in all areas where we practice. One such intervention is a homegrown hospital information system that we have deployed that includes hardwired and committed actions, aspects, technologies, steps, safeguards that ensure that everybody is dealt in a safe and effective method, which includes things like patient identification, things like surgical safety, things like infection control, things like antimicrobial stewardship, and a host of other things, all of which go into making sure that the collective care delivered is of a high quality and of a safe nature.
We felt the time had come to try and seek external validation of the quality of care that we provide. We started our journey to try and obtain Joint Commission International accreditation for our institution. The Joint Commission evaluates all aspects of hospital function. It looks at aspects of clinical care, it looks at your diagnostic services, but it also looks at the administrative or non-clinical aspects of hospital function, such as your HR requirements, how you ensure that your staff are appropriately qualified and have the appropriate experience required for them to deliver care to the high standards required by the JCI. It also looks at facilities, so it looks at your building, at your fire escapes, at your fire alarm systems, smoke suppression, and so on. So really all aspects of hospital care are evaluated during the JCI survey. When it came time for re-accreditation of the Peshawar Hospital in the summer of 2022, the Joint Commission informed us a few months before that they had launched a new process of accreditation called Enterprise Accreditation. This was ideally suited to organizations such as ours, which have multiple campuses across a number of cities or locations across a geographic region. So in August and September 2022, a team of surveyors from the United States evaluated our facilities in Lahore, Peshawar and Karachi simultaneously, at the end of which we were delighted and very proud to be only the second organization in the world to be awarded Joint Commission International Enterprise Accreditation.
My department is essentially responsible for ensuring that high quality and safe care is delivered to all patients coming to any of our hospitals across the country. We ensure that by doing third-party accreditations such as Joint Commission and ISO. We are also ensuring patient is at the center of all our activities by having a very robust feedback mechanism for patients. This feedback system essentially comprises of availability of a 24-hour helpline on WhatsApp, which is given to patients and made available to patients to leave a comment on. Apart from that, there are telephone extensions which they can call during the working hours. Also, all inpatients are visited twice a day by our team to get feedback on the services they are receiving. A percentage of all patients that have come to our hospital every month for any services are called up to gain feedback on the services that they received at our hospitals. And last but not the least, we also encourage feedback from patients through prescribed forms and comment boxes which are left all over the hospitals for patients to drop their comments on. At the end of each year, all feedback collated through these different mechanisms is analyzed to identify themes and areas on which the hospital administration can focus on to further improve the safety of care being delivered at our hospitals.
Once we have seen our patient in our clinic and evaluated them, we discuss their case in an MDT, which is a multidisciplinary team meeting involving different specialty. There we develop a comprehensive management plan for our patients. And after informed consent, the treatment is started according to COPI standards. COPI is an abbreviation of Quality Oncology Practice Initiative. It is an international standard for the management of cancer patients. In our hospital, all our cancer patients get the treatment according to the COPI standard.